Hi everyone, welcome to Bioorganic Chemistry. Today we are going to look at one of the greatest healthcare challenges of 21st century, diabetes. We will see how it is related to carbohydrate, its origin, global economic burden, and some of the scientific breakthroughs in diabetes. In 2025 alone, 589 million adults were diagnosed with diabetes. It accounts for 1 in 9 adults suffering from this disease, and nearly 250 million people are undiagnosed. That means they are living with diabetes without knowing they have this kind of challenges. The diabetes epidemic is rapidly expanding and it's affecting individuals irrespective of their socioeconomic levels and geographic regions. If you look at the economic burden of diabetes, in 2024, it was estimated that 12% of all global healthcare spending is devoted to diabetes and its complications. The number of cases are increasing rapidly, and in next 20 years, there will be nearly 45% increase in the cases around the globe, with the highest increase in Africa, including other parts of the world such as Southeast Asia, Middle East and North Africa, and South and Central America. As we improve and advance in the management and prevention, the cost is also increasingly becoming higher and higher. If you look at the origin of diabetes, the word diabetes derived from a Greek word that means to pass through. It is used to denote a large amount of water consumed and urine produced by the people suffering from diabetes in olden days. Mellitus was the word coined by Romans, meant as sweet as honey when they noticed that the urine of diabetic patients was sweet. So, the definition of diabetes mellitus is a chronic metabolic disorder characterized by elevated blood glucose level. This resulting from defects in insulin secretion, insulin action, or both of them. Insulin is one of the important peptide hormone that regulates glucose uptake and metabolism in cells. This dysfunction leads to persistently high blood glucose levels, a glucose level going beyond 126 milligram per deciliter when you are fasting, or even above 200 milligram per deciliter after taking meals. Pathophysiologically, this causes numerous complications, including heart disease, stroke, and neuropathy, nephropathy, and retinopathy. As I mentioned, that there are a few important components when we discuss about diabetes. The first is insulin, which is a peptide hormone secreted by beta cells in response to high glucose level. And second is the glucose, which is a monosaccharide, which we have studied. When we consume food, carbohydrates are converted into glucose. And this glucose is then released to our bloodstream. As a result, the beta cells in the pancreas produce and release insulin into the bloodstream. Now, insulin acts as the key and helps glucose to enter the cells in the body. Under normal and healthy conditions, insulin uh, works perfectly and glucose enters the cells. As a result, cell can have enough energy. In type 1 diabetes, there will be no insulin secretion because the patient suffering from this, they lack the ability to produce insulin. That means there is a high level of glucose secreted. Since there is no insulin, the glucose level becomes very high and then pass through the urine. No glucose enters inside the cells and cell is starved for energy. Type 2 diabetes, where the blood vessels have both glucose as well as insulin. However, the cells reject insulin, and this is called insulin resistance. Type 1 diabetes is an autoimmune destruction of pancreatic beta cells, resulting in absolute insulin resistance. This is observed in 5 to 10% of all diabetic cases. Patients are insulin dependent in this case from diagnosis onwards. Typical onset occurs from childhood to early adulthood. Type 2 diabetes is characterized by insulin resistance combined with the progressive beta cell dysfunction. It accounts for 90 to 95% of all diabetic cases. The risks include obesity, sedentary lifestyle, and genetic predisposition. This is preventable in many cases through lifestyle and diet modification. If you look at the historical perspective, in ancient times, it has been described in Egyptian, Indian, and Chinese medical writing. Ancient physicians noted excessive thirst and urination of diabetic patients. In the 16th to 19th century, uh, people recognize increasing blood sugar level, hyperglycemia, and glycosuria, that means sweet urine. And those days, there were not many methods to detect. Physicians tested urine to diagnose diabetes. It's a dangerous diagnostic method. Thomas Willis in 1674 described diabetic urine as wonderfully sweet. Matthew Dobson distilled urine and found sugar residue. He confirmed that the sweetness in the urine was from the sugar and that blood sugar was also very high. As we moved to 19th century, uh, there was a shift from tasting to chemical test. As the chemistry became more prominent, chemical testing became important. Carl Tromer developed a chemical test in 1841, which detected sugar in urine, and later tests by Hermann von Felling also used to detect sugars. We will conduct some of these tests also in the lab to detect various carbohydrates and distinguish carbohydrates. Before insulin was isolated and used for treatment, this was known as a frustration era, and diabetes was essentially a death sentence with no effective treatment. Patients diagnosed with diabetes survived only a few months. But a breakthrough happened between 1920 to 23 by Frederick Banting at the University of Toronto and his collaborators. Until then, many have guessed that insulin was responsible, that has a major role in diabetes. However, nobody was able to prove and find a way. The reason was they were not able to isolate insulin. What happens when you try to isolate insulin and extract trypsin, one of the enzyme that was breaking down insulin during extraction? However, Frederick Banting had a breakthrough here in 1921 where they were able to purify insulin. I'm going to tell how they purified. And a year later, they treated Leonardo Thompson. He became the first human to receive insulin injection. This remarkable discovery and treatment showed how powerful was insulin treatment. Because of this, and in the very next year, Banting and MacLeod were awarded Nobel Prize in Physiology and Medicine, one of the fastest Nobel recognition in history. So as I said, the Banting and Charles Best treated dogs. Those days, dog was used for various testing, and they treated in such a way that the dog was no longer producing trypsin. If there is no trypsin, that means you are able to extract um, insulin. So this insulin can be used. Exactly the same insulin isolated was used for treating Leonardo Thompson in 1922. The scientific breakthroughs evolved in the mid 20th and late 20th century. Frederick Sanger, we will also study. He also got Nobel Prize. We will see Sanger sequencing later on. He sequenced insulin amino acid structure. Hodgkin's X-ray structure revealed the 3D structure of insulin that allowed also drug design. Yalow and Beson's radioimmunoassay revolutionized insulin measurement. So now we can measure the insulin level, and recombinant DNA helped to produce a mass production of human insulin. So if you look at the innovation timeline, diabetes from 1920, the post-insulin era, then the evolution of genetic engineering and recombinant DNA technology. In the By the end of 20th century, we saw analog development, drug development, and today we have numerous mass system to continuously pump insulin and measure blood glucose level, glucose monitoring, glucose sensing from various fluids, including urine, blood, sweat, teardrops. So, how this diabetes is managed today? The type 1 management is mostly insulin therapy, continuous subcutaneous insulin injections, which combines also these days carbohydrate counting, in addition to lifestyle management. Type 2 lifestyle modification becomes important, diet and exercise, and some of the pharmacotherapies as a first line therapy. 70% of type 2 diabetes can be prevented today through weight loss, regular physical activity of 150 minutes per week at least, and dietary modification. There are numerous monitoring and screening tools available today. I will talk one simple sensing experiment, how glucose sensing is done. Glucose sensors generally contains, whether electrochemical or any type of sensors, contain immobilized enzyme that is a glucose oxidase. In the presence of oxygen, this can oxidize glucose into gluconic acid. And this electrochemical sensor, which are widely used, uh, during this process of oxidation, you also produce a molecule of hydrogen peroxide, which undergo oxidation at the anode, which is a platinum electrode. As a result, there are electrons are released, which is proportional to the number of glucose molecule. So therefore you can count the number of molecule, or you can determine quantitatively your blood glucose level. All electrochemical sensors have something in common. They have an analyte, that is a glucose. They have a receptor. The receptor is an enzyme, which is glucose oxidase in this case, and a transducer and a display. Today, variety of monitoring systems are available, and you can monitor in real time your blood sugar level. You can also use other body fluids to measure the blood sugar level, which can be correlated to some extent. There is a recommendation that your blood glucose range should be between 80 to 130 milligram per deciliter if you are fasting or before any meal. 2 hours after a meal, it should be less than 180 milligram per deciliter. So there are numerous other therapy are developed, and the research is ongoing, such as stem cell therapy, immunotherapy, a combination of GLP and GIP agents, artificial pancreas. So, as we saw, diabetes is one of the biggest healthcare challenges. And what we really need is more response in this case, such as early diagnosis, universal access, lifestyle program, research, and investment.